called as Namaste. In India, we are tuned to have this Namaste as our greeting gesture wherever we go. So when we do that with a laughing face, if we have any of the abnormalities associated, that also helps us in detecting the stroke. So be fast and Namaste are probably two things which one has to remember. So in simple words, stroke is a medical emergency similar to that of a heart attack. So why I relate it to heart attack is we understand it quite well. Heart attack happens when the block in the artery supplying the heart occurs. So similar thing, if it happens in the brain, that we call it as a brain attack, or the medical term for that is a stroke. And what we are concentrating now is talking about the ischemic stroke. As Dr. Abhishek has told us, there are two different types of stroke. The hemorrhagic stroke, where the bleeding happens, and the one where the blockage happens. So the BFAST mnemonic can be for any of these strokes, that is to identify stroke. And once the patient is identified having symptoms of stroke, he has to be immediately taken to a hospital which has comprehensive stroke work strategies which is incorporated within the hospital. When I say comprehensive stroke center, what does it mean? It's basically a hospital which has a team of doctors who are able to handle this emergency right from the beginning of the stroke to the rehabilitation and the discharge of the patient. And the capabilities which the hospital should include is the advanced imaging modalities which should be available. The treatment options which we will talk about is the mechanical cath lab facilities where we do our specialized procedures to remove the clot. And after that, obviously, we need to have a proper rehabilitation program to help these patients come out of the event. Otherwise, we know if this is not treated, these people end up having a lot of disability and around 20% even death for that matter. So a large vessel, when it is blocked, has a lot of disabilities, and time becomes very important for us when we deal with such patients, because as fast as we go in and remove that clot which is within the blood vessel and re-establish the flow within the brain, that is called as the golden period. And when we talk about the golden period, there are two types of treatment for the stroke. One is giving a medicine through the IV route, the clot bursting drug, which is